Plantar flexion, along with dorsiflexion, are the primary motions occurring at the talocrural joint. Plantar flexion occurs around an oblique axis that brings the foot down and slightly medial. The talocrural joint is composed of the articulation between the talus and the ankle mortise. The ankle mortise is composed of the distal articulation of the tibia and fibula, and the medial and lateral malleoli. Pictured here are medial and anterior views of the ankle. To determine arthrokinematics of the joint, we consider the convex trochlear head of the talus moving on the concave ankle mortise in open chain kinematic position. In plantar flexion, there's a posterior roll and anterior glide of the talus on the ankle mortise. The gastrocnemius and soleus are the primary ankle plantar flexors, with additional help from flexor hallucis longus, tibialis posterior, and flexor digitorum longus. The anterior portions of the deltoid ligament provide medial support and check excessive plantar flexion. Anterior and posterior talofibular and calcaneofibular ligaments provide lateral support and check excessive plantar flexion. The joint capsule provides additional stability and movement limitation. When performing goniometry on the joint, the end feel will be hard due to contact between the posterior tubercles of the talus and the posterior margin of the tibia. Ankle goniometry is indicated for any patients with ankle injury, knee injury, stroke, or any other injury or condition that might affect gait. However, there are also contraindications to measuring ankle plantar flexion. For example, excessive pain, open wound, or surgical fixation, such as shown above.
Table 10.8 lists the necessary ranges of motion for dorsiflexion and plantar flexion for functional locomotor activities. The range of motion is 40 degrees for adults according to the American Medical Association and 50 degrees according to the American Association of Orthopedic Surgeons. Table 10.10 illustrates that for plantar flexion, there is high intra-rater reliability and moderately high inter-rater reliability. This image shows the three landmarks used for ankle plantar flexion goniometry. The fulcrum of the goniometer is centered over the lateral aspect of the lateral malleolus. The proximal arm of the goniometer is aligned with the lateral midline of the fibula, using the head of the fibula for reference. The distal arm is aligned parallel to the aspect of the fifth metatarsal. Alternatively, the distal arm can be aligned parallel to the inferior aspect of the calcaneus, but these measurements should not be used interchangeably. For proper testing position, have the subject sitting with the knees flexed to 90 degrees and position the foot to 0 degrees of inversion and eversion. The subject may also be positioned in supine. Stabilize the tibia and fibula to prevent excess knee flexion and hip rotation. Before asking the subject to plantar flex, be sure the goniometer is aligned with the previously described landmarks and that the measurement begins at 90 degrees. For active range of motion, ask the subject to point his or her toes downward as much as they can go. Be sure to watch for compensatory movements like excessive knee flexion. For passive range of motion, push downward with one hand on the dorsum of the subject's foot to produce plantar flexion. Be sure not to exert any force on the subject's toes and be careful to avoid pushing the ankle into inversion or eversion.
Hi, my name is Crystal Yang. I'll be your physical therapist. How are you today?
Good, how are you?
Good. So what we're going to do today is measure your ankle plantar flexion. And what that means is I'm measuring your range of motion of your ankle when you're pointing your toes to the ground. Okay, so first thing we're going to do is I'll position your foot 90 degrees. And can I have you point your toes towards the floor as much as you can? And back up. And now just relax and I'll do that motion for you. And does that feel uncomfortable at all? No. Okay. And can I have you point your toes to the floor? Okay, so you're at 60 degrees. Okay, you come back up. And now, same thing as before, just relax and I'll go through the motion for you. Looks like you're at 65, which is within the normal limits.